Hey friends, Christian here. It's February 8th, 2016. Tomorrow is my 22 months on testosterone. Coming up on 2 years here, and it's so exciting. And actually, tomorrow is my 1 year post-op top surgery. That's amazing to think that a year ago I was feeling pretty nervous, anxious, and excited for the big day of the boob removal. So it's been great. It's been a great year. It's probably taken the last year really to get acclimated to my new chest and my scar healing. I've still got a little ways to go on my scar healing, but I just picked up some new vitamin E and cocoa butter oil that I put on at least once a day. I'm gonna try and do a little bit more often, maybe before bed also. See if I can help heal those scars up. But so far, I think they're healing pretty well. And I've got a couple things, just coming up, changing that I thought I would mention. One is just that I've been at my job now at the new hospital for approaching 7 months, and I float between a couple of units right now, and so it's not very swift in the friend-making process, but I'm starting to talk a little bit more with people and make friends, I guess, work friends, and people who are, pressing that friend request button on Facebook. And, with each person, I'm just kind of like, is this like an actual friendship? Is somebody just want to be nosy? And I don't know. It's weird. At one point, I contemplated, do I clean up some of my old pictures? What do you do? What do you feel comfortable with? And for me, I just decided, fuck it. I mean, I'm not hiding anything in my past, and I am who I am, and things will come up as they go forward, but I'm very proud of me and my journey, and I think that as I get more comfortable in, new surroundings, I'll be more comfortable talking about it if it comes up. But it's just an interesting place to be because I'm not new into my transition where I have to be out. I'm not in a position where I was one gender and now I'm a different gender, where they watch you change. So really, talking about my transition or talking about being transgender is not something that comes up in conversation. And to me, it is kind of the past, even though it's still a current journey. I think it's always going to be a part of me and a part of my journey in my life, but that newness of it and that constant like having to talk about it stuff is over, and I'm just living. And so it'll be interesting to see where it goes. I definitely want to be open about it, and I want to talk because I feel like I can shed new light on being transgender and what being transgender looks like. And so I think that's going to be really interesting, if and when it progresses to that point. And then there will just be a point where if I allow enough people into my life, it could be something that's not talked about with me, but talked about behind me. And so that's interesting. It's a vulnerability, but it's going to happen, and it's not something I'm going to be able to prevent, so it's just something that I can be prepared for, I suppose. However, the people that, I'm allowing to see parts of me, I don't necessarily think there's going to be this big discussion, and I think that I, have established myself enough that it could be less gossipy, the potential. One of the other things is I'm going to go see a ear, nose, and throat doctor, and so seeing a new physician opens up vulnerabilities as far as on my medical chart with the facility where I receive my testosterone, and I have my, primary care physicians. There, my chart says female. It's where I get my, downstairs checkups, and it's where I get my testosterone. And so, of course, for my sex, it says female. And I don't know, I think somewhere on there it does say transgender patient. Obviously, my name is Christian on there. But that first interaction with a new doctor and new staff, especially when you know they are looking at a chart that says F, it's a little uncomfortable. So I'm not really looking forward to that in some of these other facilities, or you go to a new place, like I've gone to urgent cares and whatnot, and I say male because my driver's license says male. If we need to have a discussion about my downstairs parts, we'll talk about that, or something going on with that that's different. I'm very open to say that I'm transgender. That's not the issue. It's just knowing that they're seeing a letter that doesn't match my presentation. It is bothersome. So that just gives me a little bit of anxiety, but I'm sure I'll be able to let it go. And then one other thing is just my fiance and I are approaching our third class. 2 of them has been canceled. We should have been into our 5th class by now for our foster care to adopt classes that we're going to. And not tomorrow, but then this weekend we have a class, and after that we will meet with 2 of the teachers to talk about us personally. And, it's just something where, will being transgender come up? Does being transgender pose a problem? And I don't know the answers to that. I don't know what my comfort level will be, but I do know that in these classes, we have had to have scenarios, and we pick these cards, and then we have to talk about them. And the 2 times we've had to do it, I have picked the card for the gay teenager. I picked the card for the transgender teen. And I'm just like, oh my gosh, God, are you trying to tell me something? Because I feel like we've talked about gay issues, minimally, or transgender issues minimally, and then here I am. And I just wonder if that is trying to tell me, that I'm in a safe place. Obviously, we know there are gay, lesbian, transgender, teens, kids who, need homes. But as far as being a transgender person looking into foster care and foster care to adopt, it's just kind of uncharted territory. So I'm not sure exactly how I will feel about that. Then there's a licensing worker that will come out, and that person's different than the people teaching the class. And so you talk about different things, and with the 2 people that are leading our class, they're the ones who actually place kids with us. So it's almost like, well, you don't want to say anything to ruin your chances because they're the ones who decide these things. But then again, if you're open and honest, it could just help you, benefit you. It's such a fine line, it's such a fine line of disclosure. And there's no right answer. It's about what's comfortable for you, but what is comfortable for me, I don't know. I'm not sure yet, because I know what I want to be. I know I want to be that open person, not necessarily that has to have a T on my forehead all the time, but in certain situations when it's appropriate, I want to be comfortable and be proud of who I am and all the things that I've learned along the way, and all the things that this journey has taught me, and all the things that my friends and family have taught me throughout this journey, and the support and everything. So it's going to be interesting. It's going to be interesting how it all goes. Those 3 situations are just coming up, and it brings up a little bit of anxiety, and it brings up that vulnerability, and it kind of brings up those things that you don't have to deal with every day anymore. And so it's a new experience and something different. So we'll see. It's exciting though, because it's different and it's a journey, and then I hope to be able to, come back and reflect and share how it all went. So, celebrating where I am and my journey and my surgery. And then I didn't know if I would make a video, but I just thought I'll just show you my chest. This is my And in this light, it's good 'cause it kind of shows you almost everything, but there are areas that are thinning just as it heals, and this, um, is it's healing, and there's going to be lighter areas, and it's all going to be light pretty soon. This spot is really interesting because I can feel the changes of the scar, every so often. It's thinning here, and so it's really neat to be able to massage them and watch them fade. It's really taken some time to get used to all this newness. Every day things still change, and you look back from pictures a month or two ago and you still see changes, and of course I love my facial hair changes. It's just awesome, and it's fun to see, and just fun to evolve. I love the evolution, and this whole evolution of me is so awesome and amazing. So thanks for your love and support as always, and I will see you next time. Bye for now.